Hello everybody, this is Dr. Kashif Abdullah. Let me just send this out if anyone wants to read that. Let's see if anyone comes in. So, let's see. There's starting now. 1 second. Can't see all hands. Is on the air. There we go. All right. So my name is Dr. Kashif Abdullah. Today it is April 29th, 2020. You can ask me any sort of question, and I'm here to help you as best I can. And let's see. I'm just trying to figure out if there are any. I've also sent out hellos. Let's see. So okay, and so if anyone has any questions, feel free to leave a question in the chat box so I can see. The more people that can ask, the better. And let's see. So my name is Dr. Kashif Abdullah, and I can answer anything about any medical topic, but usually I start off with coronavirus since that's the biggest thing these days. I do this from 12:30 to about 1 o'clock every day, well, every weekdays. And if you have any questions regarding coronavirus, feel free to ask. Oh, someone is asking me, what is my thoughts on remdesivir? So this is this is a new drug that has come up recently. It is in regards to it's an antiviral medication. It's really likely an antiretroviral medication. And I was just looking some of this up because someone asked this question, such as yourself. Maybe you were the person who asked this question. SGA4. What are my thoughts? My thoughts are, well, it's an antiretroviral drug, so that's what we need to attack this with. I was looking this up. I usually go to Metscape first. Oh, sorry. Let me switch the screens to show you what I'm showing you guys. Here we go. So let's see. So remdesivir, the question that's being asked is, what is it? So I usually first go to Metscape. So Metscape is something that all physicians can use. I'm right now logged into it, but if you're not a physician or what have you, sometimes the amount of information they give you is limited because you have to log in. So basically it is a antiretroviral drug. So let's see, what is it? It is, first of all, it's not FDA approved. It's still in the investigational phase of its creation. So what it is an IV medication, so you get it by IV, and it basically, like it says here, inhibits viral replication through mature termination of the RNA transcription, and its in vitro activity against COVID-19, in vitro and in vivo against related beta coronaviruses. So basically, it's like this. This is what it is. Okay. My thoughts are, this sounds good already. I also looked online, the politicals talking about this. It looks like this is from today, about Dr. Fauci is saying that Dr. Fauci is the head of the CDC here in America, in the United States, and he's maybe a breakthrough treatment. If that is the case, that sounds very, very, this is just literally a couple of minutes ago. Pacific updated just a couple of minutes ago too. So it's a new medication, and it looks like they're studying to see how effective it is against the coronavirus. And let's see, it likens the good news about remdesivir to the discovery of the first medicines found to help HIV more than a decade ago. So already what it sounds like is this is maybe, so instead of a vaccine, this may be our method of treating this potential virus. So this is not going to prevent you from, this is more of like you will get infected with the virus. So it's not like a vaccine that's going to treat the virus. or like prevent the virus from attacking you by activating the immune system. What this is going to do is slow down the virus. It's like basically an antibiotic for a virus, except it's an antiretroviral. And how this function is it slows down the replication mechanism of viruses. So viruses are just a virus's only purpose in life, and it is barely even alive, is all it does is it replicates. That's all it cares about. It doesn't care how it replicates. It doesn't care what it's doing. It doesn't care if it goes into what cells. All it cares about is replication. That's all it is. Replication. So it causes havoc in the cells that it infects, like your lungs, and it causes havoc with us by releasing massive amounts of inflammatory products that can cause severe flooding of the lungs and essentially like pneumonia, and may cause respiratory failure that leads to death because the body is no longer able to oxygenate its blood or remove the carbon dioxide. So, but the virus doesn't plan this. It's just like I said, all it does is it wants to replicate. So this medicine prevents the replication of the virus. That's how it's functioning. And depending on how sensitive or like how good it is at attacking the virus, we'll see. I think it looks like this is just positive data. So we don't have enough data to tell us what this really is or is not. But it looks like it's maybe a breakthrough. If Dr. Fauci is saying it's a breakthrough, let's hope it is. He's one of the preeminent physicians on this issue. And it's saying here, the news reminded him of the day 34 years ago when modest results for the drug AZT was signaled for the first potential weapon against HIV. So we may have finally a way of treating this, or preventing the spread. It's like giving an antibiotic. So we may have found a way of treating it without vaccines. Like I said, vaccines going to take time to start, but it may be a very crucial step. Now, like I said, you cannot. Well, I will say this: this is not going to prevent. This is not going to right now. We need to still do the social distancing. We still need to take precautions. This is just a first step. It may be good. It may not be good. So let's not just put our hopes on one thing. But it's a good sign. Hopefully, they can really test this quickly and maybe put this to market quickly too. So let's see. So far, there have been 3 million thus far cases that have been diagnosed. And if we look at the daily increases, we can see that there is a very minor, slight negative trend, very slowly. So we're at least not going up and up and up and exponentially. The world is no longer, so coronavirus is beginning to plateau, essentially. I think we can safely say that right now. Now, when is a second wave, or if a second wave hits, we have yet to have any data. We have yet to see that yet. But this might actually help prevent a second wave, if this is really good. Let me just go back. And of course, if you have any questions, feel free to ask. Sorry, let's see. I'm actually mentioning let's see. I am doing a live stream right now regarding coronavirus. In California. Let's see. I'm just trying to recruit people, telling them that I'm here. Okay, let's see. So Spain. Let's see where the U.S. is. So the U.S. is now, unfortunately, 1 million cases. We have almost 60,000 deaths in the United States, unfortunately, and there is a slight negative trend going down, which is good, but it's going to take some time. Let's see. Spain is also trending down, much more nicely than the U.S., of course, and they and Italy is also, they're trending down nicely. There's a steady march. I will say by the end of May, Italy will have controlled this virus. Spain, I would imagine about the same. Let's see, France. It's hard to say. I think there, well, there's these outliers that really make things hard to figure out. But it looks like a negative trend, And the United Kingdom is sort of like the U.S. Their numbers are nothing like the U.S., but they're beginning to slightly trend down. That's good. Germany has really trended down, and Germany, I think, it should be able to finish this by the middle of May. Turkey is also beginning to really control this. So they were really getting scary here in the beginning of May, but April, I'm sorry, but now they're beginning to drop it down. So that's good. Russia, unfortunately, is still going exponentially higher and higher. There's a sort of a slowdown here. That's good, but Russia, I can say, I have heard really bad things are happening, and frankly, the leadership is not doing anything. Putin does not sound like he's actually controlling anything, and wants to just sweep it on the rug. Iran, I don't know if this is really real. Let's see if there's any questions real quick. No. Again, if anyone has any questions, feel free to ask these questions here in the comments. I'm going back and forth. And let's see. China is meaningless to even see. I think they fixed their data. Oh, that's one of my associates who was wanting notes. I'm a physician, so okay. Anyway, Brazil unfortunately is going exponential. Canada, let's see. The Canadians are slightly trending down. It looks like the numbers are again nothing like the U.S. and they're lower than even I think the U.K.'s. I think, but they're beginning to go slightly down. It's trending down. Let's see. Belgium is also coming down. Switzerland is almost controlled it completely. I did want to speak about Sweden just for a quick short bit. So, Sweden apparently is doing what they want is herd immunity. They sort of are letting it's sort of like almost the U.S. And I think this is not their numbers are nothing like anywhere else. They're very small, and they basically want people to essentially take care of themselves if they get infected and they get cured. They want to create like some kind of herd immunity. I think that's not great. Frankly, I think Sweden should have done contact tracing. I don't agree with their herd immunity idea of letting people getting sick and then those people who are healthy and um, you know and Sweden's sort of like not that densely populated. I think contact tracing would have been much better, and that's what New Zealand did. If we go to New Zealand, they did really well. I'm not sure if you recently read in the news about New Zealand. Where are they here? Did I miss them? They're here somewhere. Where are they? There they are. So New Zealand has completely, essentially eradicated the virus. They have now, I think, 3 cases yesterday. That's it. 3. So they and South Korea have effectively vanquished the virus for now. Now they're going to have to do constant vigilance. But where is South Korea? They're here somewhere. Here they are. So they have essentially vanquished the virus completely. This is exactly what we're looking for, and this is what eventually the world map will look like, where it's just petering out. So you see how long this is going to take? It took even though I would imagine the world is going to take this long, and one of the reasons it'll take even longer is the United States. Frankly, they're one of the worst ones that control this virus. Let's see what other questions can we answer here. Let's see. Let's see what else. Oh, and if anyone has any question, anyone wants to leave a comment, please let them know. I'm also on Twitter. If anyone's interested, I can show you my Twitter account. Let's see. So there's my Twitter account. So I have a Twitter account. If anyone's interested, they can ask. But someone at one point was asking about a Twitter account. And let's see if I can recruit some more people here. Okay, let's see. Let's see if virus. I'm doing a live stream right now. So there's that. I'm trying to just recruit people into the live stream. And then let's see what else I can. Are there other ways I can recruit people here? Virus, there we go. And I can go to the filter and go live. See who are talking right now. Let's see. Oh, this one has, these are disabled. So let's see if this is. Oh. Virus. Let's see. Is there anyone else? Okay. So you know, there's. Let's see, what else can we talk about? Let me switch screens here. Okay. Well, let's see. If we look at the various trends in the United States, we can see that, let's see, where is coronavirus cases increasing? And you can see right now, of course, the United States has the greatest amount. This is actually stuff we've already gone through. Let's see. I'm just looking to see if there's any. Oops. Any questions? Let's see. It's always weird doing this new live chat, live stream chatting. Let's see. Just trying to figure out. Okay, and so if anyone wants, they can ask any kind of questions. I'm here from 12:30 to 1 o'clock. Just again, if anyone wants to ask about live streaming, I do this every day. I'm hoping to see if more people want to listen in. They can let others know. Let's see. Let's see. I can show you more trends if anyone wants to ask. Let's see. Let me switch the screens here again. There we go. So there's that. Let's see. It's always sort of interesting seeing other people's live stream happening. I don't know how anyone even answers any of these live streams, or if actually anyone reads these live streams. I think they just look at the data. But let's see. Let's see, what else can we show you? Oh, I can actually talk about RNA replication and remdesivir. So let me go to Google. Okay, RNA replication, and I can show you what this means exactly, how RNA replication happens, and remdesivir. Let's see, what is the let's see, let's see, where is remdesivir activating at? So I want to show and talk about how COVID-19, what it does and where does it go and how does it get replicated. So if anyone has any questions, let me know. But let's see. So what happens is you have a coronavirus here, And the virus essentially is, this is the virus itself. So the virus looks like, so what is, okay, this strand is RNA. It's basically it's the information of the virus, or how to make more of it. Really, that's what this is. This is the capsid. This is the basically the covering around it, and these are some of the binding proteins that the virus has. So cells have these receptors. Every cell has a receptor, lots and lots of receptors, and these receptors, once they've been bound, suck the virus in, or they basically are their doorways into cells. So this binding protein attaches to this receptor, and then it activates a system within the cell to actually absorb the virus willingly. The virus is then introduced inside the host, and the capsid opens up, and the RNA unwinds, and it has its own replication proteins that then create more of the virus, and you can see that right here. More of the virus is being created. So what happens is it creates a whole bunch of strands of information. One to make the envelope, one to make the membrane, one to make those binding proteins, one to make the DNA, RNA proteins, and the RNA itself. They all mix together. You can see here that they're mixing together, and then they basically envelop this protein and get kicked out. And all the virus does is it wants to replicate this process a million billion times, as much as it can. So remdesivir is a antiretroviral, so it will basically prevent this part right here. It will prevent the RNA replication, or ribotide nucleic acid replication of the virus. And this is how it stops the virus from creating more of it, by stopping this replication of RNA. It makes all the coding proteins and all the codings things, but there's no RNA, there's no information. They're just blanks being sent out. So this is the hope that the remdesivir or antiretroviral is going to work on. Let's see if there's any other questions. But basically that's how it's supposed to work. And these are just topics. Let's see. Let's see now. Some more things about DNA replication, or RNA replication. This aspect. Okay, remdesivir for acute respiratory distress syndrome coronavirus. So this is another good one. This one must be brand new if it just came out. I would imagine this came out. Yeah, this came out. And it looks like it came out on April the 2nd. Travel Medicine Infectious. Remdesivir for severe acute respiratory syndrome causing COVID-19, evaluation of the evidence. So if you get down further, we analyze the... let's see. So they're just trying to say the first medication experience of the reverse. China has also taken immediate action to put remdesivir into clinical trials with the purpose of applying into clinical therapeutics for coronavirus disease 2019. So it says here there's no specific drug yet. So this is the first antiretroviral drug they're trying to create. These are some of the animations or pictures they're showing of where it works. So right here, you'll notice it stops the creation of the RNA. So it's basically an RNAs. It prevents RNAs from being from remdesivir. So it looks like what it does is it binds to the RNA, and when the RNA's polymerase, this is the thing that replicates the RNA, comes to this. So what happens is you get a strand of RNA, right? And the replication mechanism of the cell is making more and more. This red line is more and more RNA, or a new virus being created. So what happens is it basically clogs the machine and prevents more RNA from being created. So that's how it looks like remdesivir works. Okay, well, it looks like we're coming to the end of the hour. If you have any questions, I'm here Monday to Friday from 12:30 to 1. Let me just change the views again. There we go. I appreciate any kind of thoughts or questions you may have. And I would, if you have anything you would like to ask, please let me know. And thank you again. Bye bye.